we have to understand the normal circulation of the body. Deoxygenated blood comes to the right side of the heart. From there, it goes to the lungs for getting oxygenated, and this oxygenated blood comes to the left side of the heart, from where it is distributed to the rest of the body. The normal pumping function of the heart is 55 to 65%. When the heart is not able to pump blood as per the requirements of the body, there is back pressure changes. That means the pressure in the left side of the heart increases, as a result of which there will be lung congestion. Because of lung congestion, the person can experience symptoms such as fatigue, tiredness, breathlessness in lying down position, and so on. These all are the initial symptoms of heart failure. As heart failure further progresses, there would be increased pressure which is transmitted from the left side of the heart to the lungs, and from lungs to the right side of the heart, and then there would be congestion to the entire body. That means there would be filling of the fluid in the legs, in the abdomen, and even the neck vessels would be congested. Heart failure can be predominantly of reduced ejection fraction. That means the ejection fraction is less than 40%, and preserved ejection fraction. That means the ejection fraction is more than 50%. In either of these conditions, the heart is not able to pump blood as per the requirement of the body, and there would be back pressure changes. And because of back pressure changes, the excess fluid overspills into the lungs, leading to fatigue, tiredness, and breathlessness. Heart failure is quite different from acute myocardial infarction and cardiac arrest. A cardiac arrest is when, because of any of the above reasons, may it be a heart failure, acute myocardial infarction, or any other predisposing condition, the heart goes in a standstill. The heart can go into a standstill because of two reasons. May it be an excessively fast heart rate called as a ventricular fibrillation or ventricular tachycardia, or an extremely slow heart rate called as an asystole. These can lead to a cardiac arrest. So I would like to bring your attention to these three entities. One is heart failure, second is heart attack, third is cardiac arrest. These three are different things. Heart failure means increased pressure in various chambers of the heart because the heart is not able to pump blood as per the requirements of the body. Heart failure may be caused predominantly because of some blockages in the arteries of the heart, which lead to reduction in the pumping function. Or it can also result from increased blood pressure or any other forms of cardiomyopathies. In heart failure, when the patient is not able to pump blood as per the requirement of the body, the fluid then extravasates into the lung, causing breathing difficulty. Many a times, there can be a low hemoglobin or fever, infections, or any other predisposing factors which can cause worsening of heart failure. In a few circumstances, when the heartbeat becomes irregular, called as atrial fibrillation, there can be worsening of heart failure. As we know that in heart failure, there is fluid overload. So most important is fluid restriction. That means you need to restrict your intake of fluids. Fluids means Water, soup, tea, coffee, juice, even the gravy of the vegetable that you're taking needs to be restricted. So total fluid restriction should be between 1000 to 1500 ml per day. Your doctor would be the best judge to tell you how much fluid restriction needs to be done. Second, you need to do salt restriction. That means try to reduce the salt in your diet, including bakery products, packed foods, packaged items, etc. There are multiple medications available for treatment of heart failure. Initially, for symptomatic benefit, we have diuretics, which cause increased loss of fluid via the urine. Once the patient is symptomatically better, we try to improve the outcome and prognosis by giving medicines which improve the lifespan of the individual. If there is life in the myocardium, that means if the heart muscle is likely to recover with an angioplasty or a bypass surgery that can be offered. We can also offer multiple kinds of pacemakers. There are specific kinds of pacemakers for heart failure. One is AICD, that means automated implantable cardioverter defibrillator. Patients with heart failure are prone to arrhythmias, that means electrical disturbances of the heart. AICD is something like a defibrillator, and it can revert the abnormal rhythm of the heart and can save the individual before the patient can even reach the hospital. The other kind of pacemaker is a CRTD, that means cardiac resynchronization therapy with a defibrillator. This would help in better pumping function of the heart so that the heart's ejection fraction and the amount of blood that the heart pumps is improved. Overall, if the patient follows all the instructions of the concerned doctor, takes the necessary treatment, a patient with heart failure can aim to live a near normal life. Heart failure is a treatable condition. It is possible to live a near normal life with heart failure, and the multiple medical, surgical, as well as the interventional treatments we offer. We try to improve the longevity and lifespan of the individual.